after such a difficult winter infection. The common cold itself may not be increases rapidly in the first stage, the acute stage of the disease, but then afterwards the cells are not able to maintain themselves and the virus then decreases. But at this time, you are still transmitting the disease, the viruses, in your secretions, primarily secretions from the genitalia. Oral secretions, yes, you can, but the chances of getting contaminated, they are minimal. But it is important at this stage to understand that it's a preventable disease. 2, haven't got it, it's extremely aggressive. Now, when you diagnose with it or think you may have a chance, the tests are very simple. At that point in time, you develop a habit of, now I've been exposed to a life-threatening illness, I will now have to try and protect the rest of my life as much as I can. But also remember that it is not the right or the prudent thing to try and infect others when in fact you are the victim of your own demise and not someone else who gave you the HIV virus. Because a lot of times I hear this as being a remark by others, I got it from someone, so I'll be giving it to as many people as possible. And believe you me, there have been cases that have been described in which young men and women haven't gotten the HIV virus, then engage in a very reckless behavior pattern of trying to spread it to as many as possible. If we understand the disease before it becomes, before we get it, then we can at least be able to alter our behavior even after we live with HIV. In continuing our discussion on HIV and AIDS and the ways and means of preventing it, and addressing this to our young people in general and the general population at large, is that it's such a preventable disease. But having been diagnosed, we need to change our habits and behavior prior to diagnosis and even after diagnosis to make sure we live the best possible life we can. We also have to be aware, if we know beforehand what are some of the complications and the long-term sequelae of HIV, and when we develop AIDS, we will try and avoid and prevent it as much as we can. I know there's a lot of tremendous pressures out there on teenagers to conform, especially with the types of music, the type of behaviors, the types of behavior patterns that are being condoned, but to understand that HIV is unlike any other sexually transmitted disease out there, that basically it is up to you to try and prevent yourself from getting it, and also from those of us who engage in sexual activity that poses us at increased risk, and thinking that HIV and AIDS is something of the 80s and the 90s. I have news for you. I've got enough patients in my practice that I can safely say to you, HIV is very much alive as it was, and much, much more now with the frequent travel to Caribbean islands, etc. And Guyana is one of the places, I sad to say, Trinidad, Jamaica, and other parts of the Caribbean, in which the management of HIV leaves a lot to be desired. In fact, one of the complaints by the World Health Organization is the very little resources that are put towards the treatment and education of HIV in the Caribbean countries that I mentioned. That leaves us thinking, what role can we play and try to assist in the education and also the treatment and the early availability of medications for patients as they're diagnosed. Because when you look at the side effects and the complications of HIV, it makes you feel even more the need that this education process be continued and all the time be at the forefront of our minds as we address it. The first couple of weeks with getting the infection, the virus replicates to such massive numbers. Then we go for that period of time, which we sometimes think can take us up to about 10 years. But a lot of cases in the Caribbean, and especially in my home in Guyana, basically I find that this period of 10 years is much, much shorter. That's basically because of a simple fact that you continue to engage in the sexual activity that got you it in the first place, and then basically what we have experienced in the United States is once you get diagnosed and treated. And how is the diagnosis made? Diagnosis made, you get these flu-like symptoms. You start to get 1 or 2 lymph nodes in the neck. You find yourself to get oral monolysis or thrush in the mouth without any reason. Find that your immune system is down. You do a very simple test, a blood test, just a simple blood test that shows a Western blot positive. Then you confirm it with an HIV ELISA, because it's such an important test to get right that they've actually mandated that 2 tests be done before passing on that information to the patient. After that test is done and confirmed that you're HIV positive, then the next test to be done is a T cell count. How important is this T cell? initially as you make your diagnosis is 100, the T cell count is usually about 1,000 cells per cubic millimeter blood. Once the infection is established, and this could be, it says, usually about 10 years. But as I said, our experience in Guyana has taught us that because of the fact that the immune system, multiple sexual partners, not being treated for simple infections, this period of time is much shorter than the 10 years that's been actually the 5 to 10 years. It's sometimes usually 2 to 3 years, and probably sometimes even less. I've seen a case even up to 6 months from going from a T cell of 1,000 to a T cells of less than 200. Less than 200 means that the chances of opportunistic infection, those are infections you never would have had, is much, much higher. Less than 50 means that you basically do not have an immune response, and anything that passes around, things like organisms that spread from birds, etc., Cryptococcus, etc., things that cause toxoplasmosis, other parasitic infections that ordinarily would not have caused you any problems, now cause you problems. And what are those problems? They're massive problems. If we look at it in terms of the end organs that are affected, in terms of the central nervous system, in very young individuals with HIV, but it also affects the older ones. We expect you to have a brain tumor or infection of the brain with the worst headaches in your life, not being able to focus, short-term memory loss, long-term memory loss, persisting headaches, nauseous vomiting from infections like toxoplasmosis gondii, which tend to cause loss of vision as it infects the brain. It can cause paralysis on one side. It can also cause seizure and confusion and eventual death. You can also get Cryptococcus infection involving the brain, which can give an acute infection, very easy to diagnose by ring enhancement lesion. You can also get non-Hodgkin's lymphoma, which is a lymphoma that a lot of us know about from the T cells that are affected. But basically, this can also infect the brain itself, and it's usually one of the later stages of the diseases. You could get herpes zoster, the same one that causes chickenpox or shingles, to cause painful rash or exudate that occur over the sides of the face or the chest wall. My patient who literally had 2 pneumocystis carinii infections obviously had a severe respiratory tract infection in which you were unable to breathe. In fact, you actually sometimes have to be put on a ventilator in order to survive. The treatment of choice is Bactrim, but at least at the same time, 2 or 3 infections in that case is considered terminal. In fact, other infections that commonly occur is tuberculosis, and one of the most common reasons for the resurgence of tuberculosis is because of the increased incidence of HIV. The tuberculosis that we get in an HIV patient is resistant to the normal medication, and sometimes instead of triple, quadruple antibiotic to treat the Mycobacterium tuberculum is basically what is sometimes make the difference. However, it's for a prolonged period of time, and the side effects associated with the medication sometimes make the patient feel much iller than they actually are from the HIV. From the side effects of the medication, made that person's lifestyle much more less than desirable because of the side effects of the medication. We also have infections involving the skin with herpes blisters and a skin cancer by the name of Kaposi sarcoma, which cause raised purple patches on the skin itself. The digestive system, we can have difficulty swallowing from the oral pharyngitis caused by the candidiasis. We can also get infections involving the stomach. That's basically caused not only from the candidiasis, but it can also be caused by other organisms, other fungus that infects the stomach. We can also get incidents involving cryptococcal infections involving the stomach, giving chronic diarrhea. So to understand that HIV and AIDS, that basically the complications of AIDS as it affects the central nervous system, as it affects the upper respiratory tract infection, the upper respiratory tract, as it affects the lungs itself, as it affects the musculoskeletal organs itself, is an unending downward trend to a total demise of every organ system at the same time. So even though sometimes we're fortunate to survive HIV for at least 10 to 15 years, sometimes in the case of Magic Johnson, the issue about the life expectancy and the quality of life of that individual is so decreased and deteriorated that most of the time towards the ending half of that disease process, which means having been diagnosed and you live the best possible life you can, after the first 5 years, it's a downward trend in terms of what you're capable of doing. With the memory losses, with the weakness, with the chronic diarrheas, with the chronic infections, with the fact of having to go to the doctor's office so many times to be treated for simple opportunistic infection, make all of this not worthwhile. The best way of even trying to understand HIV and its spread, and remember, it is never spread from secretions like saliva, and it's never, well, it's rarely spread, or toilet seats, or using some dishes that others have used before, or using some cloth or utensil that others have used before. It is primarily a disease of unprotected sexual intercourse with multiple sexual partners, or with an unfortunate incident with somebody who's HIV positive. But the best way to try and prevent it, to prevent the disease, is from avoiding it totally. Cigarette smoking and smoking in general. Every time someone smokes tobacco, the actual smoke that emanates from that cigarette contains at least about 200 poisons. We also know a startling fact that it's probably the leading cause of death among males and one of the increasing leading cause of death among females. The issue to do with cigarette smoking, it's a totally preventable disease. And as such, unless we understand what it affects the organ system, then we will have no motivation not to smoke. The increasing price of cigarettes have actually been one of the deterrent things, as well as the educational programs. In fact, one night I was looking at TV and saw a amount of mucus. So we always with a chronic smoker, you have them repeatedly coughing to bring in up that mucus. What happens as the mucosal edema increases, the smoke also kills the hair cells, which actually works as a mechanism to bring the mucus up. So that is now killed, so the mucus remains within the lungs itself, and there's always a sense of difficulty breathing and difficulty in terms of exhaling. Inhaling, you have these large voluminous lungs, but they're very spongy lungs, because what is happening to them now is not only the increased amount of mucus from the mucus glands, which are edematous, and the increased blockage of the air getting to the alveoli. What is now happening, you're killing the hair cells, which helps you to bring up the mucus itself. But in addition to that, you're also destroying the surfactant, which now causes the alveoli, which are these thin bubbles at the distal end of the airway tract, of the air, that allows the gas exchange between the air coming into the lungs and the blood vessels that run throughout it. Now, what is happening now, instead of having these nice little bubbles, which increase, because the surface area, the increased maximum surface area you can get is out of a sphere. Now, if you actually cause these spheres to become like emphysematous, meaning they lose the surface, now instead of having very many small bubbles with an increased amount of area, you have one large bubble with a decreased amount of area, so the gas exchange is decreased. Hence, we see these patients who are chronic smokers who are sitting in a wheelchair and breathing as if they're doing a tremendous amount of effort. That is because what the smoke has done, that the hydrocarbons has done, is to damage the airway itself, decreasing the small alveoli, which are now become enlarged and now become bullous, and there's no gas exchange that's taking place. We'll talk in the next discussion about what happens to the bronchus in terms of bronchogenic cancers, why is it so difficult to diagnose in its early stages, and why it's so important for us, once we establish that we are at risk for lung cancer, to stop cigarette smoking totally, because that cell, which is now carcinogenic, can revert back to normal if we stop cigarette smoking. If I were to tell you that cigarette smoking increased your risk of lung cancer, I'm sure the majority of you will say, yes, I knew that before. But if I tell you that cigarette smoking increases your risk of lung cancer, that is so very difficult to diagnose until it's in the advanced stages, you probably might wonder why. But if we look at this diagram and we see when cigarette smoking causes lung cancer, This is the bronchus. This is the only way we're able to look inside of the lungs. We can do a CAT scan and probably diagnose it, but not in the early stages. If you pass a bronchoscope into the lungs, you're not able to see what is inside of the lung parenchyma. And this is where the cancers usually form initially. They form within the lung parenchyma. You're very lucky if they form within the bronchus, but more often than not, it's when they spread from the lung parenchyma into the bronchus that when we are diagnosed with hemoptysis, coughing up of blood. But by that time, the cancer had actually spread from the lung parenchyma into the lymph nodes itself, the carinal lymph nodes, and basically then it can be visualized on when it affects when it's inside the inside the bronchus. So lung cancer itself, we all know it, yes, cigarette smoking can cause lung cancer. And it actually, cigarette smoking for 1 pack a year for 10 years decreases your life expectancy by at least 8 years. Casual smoking of cigarettes probably decreases your life expectancy between 4 to 5 years. But the morbidity and mortality associated with it, other coexisting conditions that are caused by cigarette smoke itself, leaves your life expectancy much more decreased than is suggested by these numbers. When I tell you that basically cigarette smoking increases your risk of having a stroke, you may wonder why. Cigarette smoke itself, and this is not the nicotine. The nicotine is a nice part of it. It's similar to the product of caffeine, which makes us feel very much awake and alert after we drank a cup of tea or coffee. Nicotine does the same for a person who smokes. But what it does, what the smoke does, it's where the harm of this is being committed. Out of those 200 or plus poisons every time you smoke, it's not only to yourself that you inhale this, but you spread to others who are around you. You can increase the risk of a stroke by causing hardening of the arteries. Hence, it increases the risk of having rupture of that artery. It increases the risk of atherosclerosis. Why I'm saying that is because the atheromatous plaques that form within the arteries themselves, because this is now effects of our diabetes and our high cholesterol form within the arteries. But now what our cigarette smoking has done is to make the arteries themselves much more hardened. Hence the reason they cannot expand as much. Hence the plaques themselves become decreases the lumen of that artery itself, so increasing the risk factors of coronary artery disease. It also increases the risk of oropharyngeal cancers. Is probably in Chinese males, probably one of the highest cancers and the highest risk rate of cancers in the world. And probably a lot of us who have traveled will have seen very numerous persons with voice box, and one of the most common cause of oropharyngeal cancers resulting in a loss of the vocal cords and that entire portion, causing us to have a laryngoscope inserted here, and we speak through the laryngoscope. But what we have done already is to damage those arteries in the brain itself to increase the risk of stroke, increase the risk of coronary artery disease by the non-pliant arteries, increase the risk of oropharyngeal cancers, because it decreases your appetite, it increases the risk of formation of ulcer because it increases the amount of gastric juice, and hence the reason of gastric juice against an unprotected stomach, increase the amount of acid, increase the formation of gastric ulcers. For males and females, much more common in males, is the fact that because the cigarette smoke, the poisons from the cigarette smoke is absorbed into the bloodstream and then is filtered into the kidney. When it passes through the urine, when the blood is filtered through the kidney and it comes through the urine, it remains in the urinary bladder, and cigarette smoking is one of the most common causes of bladder cancer. But much more important for us, especially for the new generation, is basically cigarette smoking. And that's why it should be banned from all public places and banned from even private places, is what it does to the fetus. Because the nicotine itself decreases the blood supply to the fetus. Now that fetus is not getting enough blood that it's usually supposed to have. Also, in addition to that, when the maternal blood, when the mother smokes or inhales the smokes, or the father smokes and the mother inhales, basically what happens, that hydrocarbons now enter into the blood and is now from transplacental transfer from the maternal blood to the placenta, and can cause all the damages associated with fetal smoking. Hence, it's important to know it's not only the carbon monoxide that's associated with this, but also in addition to that, we also find that it's the hydrocarbons that being the poisons that are being exchanged from the mother to the child, resulting in intrauterine growth retardation and some of the other more common factors that we see in mothers who have engaged in smoking. It's one of the things that I think in the Caribbean community we take it for granted. We are not listening to the ads, or we do not take it seriously enough to understand that cigarette smoking has been established as probably the most common cause of cancer in males. It is much more fashionable for us to engage in smoking as we go into the bars, but here again, it's our risk because of a simple fact: we are in an enclosed environment, especially during the colder months of the year. Also, in addition to that, we think by smoking only in our cars or in our backyards, we're not exposing our kids to the cigarette smoke. The same cigarette smoke that's absorbed on our coats and our shirts, it's when our kids climb on our shoulders, they inhale the same smoke. They're exposed to the same hydrocarbons that can cause the diseases that I've alluded to, basic in terms of the respiratory tract and outside of the respiratory tract. Also, in addition to that, what we're doing is, and we've established this in the Bronx especially, is increased incidence of asthma in kids because of the cigarette smoke that they're being exposed to in closed environments. So it's extremely important that we realize that cigarette smoking is no longer fashionable. It's no longer something that we think can cause diseases. It's already been established that it is one of the foremost preventable diseases. In the United States, the education level against cigarette smoking is so high that it becomes one of the major points for politicians. But in the Caribbean, it's still to reach that stage where cigarette smoking is still considered a fashionable exercise. And I think a little bit more education in that part of the world can lead to much improved lifestyles having been diagnosed with some of these diseases.